Well, straight to the news, the government is warning Kenyans that the country is edging to a time bomb if behavior is not going to change in combating the coronavirus pandemic. The Ministry of Health sounded the desperate warning as 418 cases were confirmed positive for the virus in the last 24 hours from 2,474 samples. And according to the ministry, 93% of the caseload are community spread, with only 2 counties of Baringo and West Pokot spared. Only 2.
Kenyans tested positive for coronavirus, bringing Kenya's caseload to 13,771. Some 4 people succumbed to the virus over a similar period, with the Kenya's death toll now standing at 238. The Ministry of Health further reports that 93% of Kenya's infections, about 12,800 of the total cases, are community spread.
What this means is that now we have community transmission well entrenched within the counties, and we should expect to see more and more people who will turn out positive as time proceeds.
The ministry worried on the complacency by a section of Kenyans who still think the virus was just another hoax.
In the past few days, we have continued to witness misbehavior by some Kenyans, including some of our leaders who are hell-bent on flouting all measures that have been put in place. I am saddened that particularly here in Nairobi, where the numbers are growing in their hundreds every day, a lot of people do not seem to care and have thrown all caution to the wind.
Nairobi County takes the lead of counties affected with 8,036 cases. Mombasa has 1,841. Kiambu comes third with 823 cases, Kajiado 697, Busia 636, while Machakos and Migori counties 400 and 215 respectively. Nakuru 200 cases, Uasin Gishu 166, Kilifi 95, Makueni 72 and Kwale 56 cases.
This virus has spread in most of our villages and towns in the country, and probably there are many undetected cases, as the targeted testing that continues throughout the country may not have unraveled some of these scenarios.
Health Chief Administrative Secretary Dr. Rashid Aman also noted 494 COVID cases have been discharged in 24 hours, raising recoveries registered since April 1st to 5,616. The recoveries include 465 patients who had been placed under the home-based care program. As the coronavirus pandemic continues to devastate countries, and with scientists working round the clock to develop a vaccine for this deadly contagion, people are being urged to adhere to guidelines believed to be effective in preventing further spread of this deadly disease, including washing of hands, wearing the face masks, and staying at home where necessary. Purity Museo, Channel 1 News, Nairobi.